Hello and welcome. So in Crohn's disease part 2 video we will be discussing and I will be explaining a few more points on Crohn's disease which were left in the previous video. So this is the diagram. In this diagram we can see the rectum, the anal canal which is of 4 centimeter. The anorectal angle is of 120 degree, and due to this curvature the stools which are present in the rectum, this is impossible for the fecal matter to come into the anal canal due to this curvature, and while defecating this angle changes. We can see the insertion of puborectalis muscle. We can see that there are two type of perianal fistulas, high type anorectal fistulas and the low type anorectal fistulas. In high type, this is called high type because the fistula is coming from above of puborectalis muscles, and in low type the fistula is coming from below of the puborectalis muscles. Just below puborectalis muscles we can also see glands of bowel. Their secretions are so foul smelling that in low type anorectal fistulas the patients present with foul smelling secretions. This malodorous discharge through opening posterior to anus will lead to poor perianal hygiene and perianal sepsis as well. In high type anorectal fistulas, as it is directly connected through the rectum, so stool itself is coming out of the fistula, but this high type of anorectal fistula is unlikely to occur. The normal length of the anal canal is 4 centimeter. The normal angle is 120 degree, and the insertion of muscle at the junction of rectum and anus is puborectalis muscles. So this is the basic anatomy and the fistulas, perianal fistulas, that I wanted to discuss with all of you. Moreover, two drugs which I want to discuss is mesalamine and sulphasalazine. I want you people to keep this in mind that sulphasalazine is not used in Crohn's disease. Why? Because as it is a prodrug and it gets activated by the large gut bacteria into 5-ASA, aminosalicylic acid, so it heals only the large gut. But in Crohn's disease, the disease primary site is ileum. So sulphasalazine is not used, but mesalamine, which is a controlled preparation, it releases 5-ASA in distal small intestine, which is the ileum, and their healing is required and their healing occurs. So it is used in Crohn's disease. So this is the basic difference, and I want you to keep in mind this again, that sulphasalazine is not used in Crohn's disease. Furthermore, perianal fistulas are the most common fistulas which are seen in Crohn's disease. We have discussed two types of perianal fistulas, high type and low type. Furthermore, vesicocolic fistula can also be seen, in which fecal matter going to the bladder and which is leading to cystitis, which is inflammation of the bladder, and pyelonephritis. Further, fistula between intestine and skin can also be seen, which is known as enterocutaneous fistula. A hole in anterior abdomen can be present. So these both type of fistulas, vesicocolic and enterocutaneous, these are the fistulas which are not commonly seen. Furthermore, there is hygiene hypothesis which I wanted to discuss. So what happens in western part of the countries, microwaved food is consumed much, which is leading to imbalance between the good and the bad bacteria. So the bad bacteria numbers increases much, and they release TNF alpha, which causes inflammatory bowel syndrome. So this is the cytokine TNF alpha. When it gets much in numbers, so it will lead to inflammatory bowel syndrome. So I wanted to discuss these points and wanted to explain them. So I hope you will learn, and just follow me for more videos, and stay tuned, and please subscribe my channel, like and share my video. Thank you very much.